Hello everyone, this is the ending of chapter 33, acute care. I wasn't able to complete chapter 33 and I wanted to talk more about the emergency care. So this is the slide that we left off on for emergency care. I wanted to say regardless of the type of emergency, the following basic goals guide nursing actions. So maintain life function, prevent and treat shock, control bleeding, prevent complications, keep the patient physically and psychologically comfortable, observe and record signs, treatments, and responses. Make sure you assess for causative factors. Whenever there's a question regarding whether a true emergency exists, nurses should err on the side of safety. It is far better to obtain a chest x-ray that results in a negative finding than to believe it would be unnecessary bother or expense to have the patient suffer from a delayed diagnosis. As you review this slide, the most common infection in the older population is urinary tract infections. I know I spoke of this various times in clinicals. Also, in older adults, signs of UTI could include confusion, incontinence, vague abdominal pain, anorexia, nausea, and vomiting. Did you know all of that? Patients with diabetes may experience a loss of glycemic control. So, diagnosis can be confirmed by laboratory tests. Also know that bacterial pneumonia is the leading cause of infection related to death in older adults. Okay, let's get that back together. Bacterial pneumonia is the leading cause of infection related to death in older adults. As with other infectious processes, symptoms can be typical and include confusion, lethargy, and anorexia, in addition to the typical signs associated with pneumonia in any age group. So make sure that the serum and blood testings are done to confirm the diagnosis. Careful attention must be paid to infection prevention in older adults. Measures that assist in this effort include promoting good hydration and nutrition, monitoring vital signs, mental status, and general health status, maintaining intact and mucous membranes. An emergency condition is expected. It is better to err on the safe side and obtain diagnostic tests. Now, I've said that twice already. So we want to make sure also that we are avoiding immobility, ensuring pneumococcal and influenza vaccines have been administered. So we have to be advocates. We want to make sure that the environment is clean, restricting contact on persons who have infections or suspected infections because the immune system is down. We want to make sure that foods are stored properly. We want to make sure we're preventing injuries. And we want to adhere to infection control practices as simple as washing our hands before going in a room and after leaving a room or the patient's environment. So don't forget that a variety of vitamins and herbs have been promoted for the prevention and management of infection. Okay? And then also vitamin C and vitamin A supplements are recommended, as is the elimination of refined sugars from the diet. So, and don't forget about the herbs like echinacea. A lot of people, when you start getting sick or prior to getting sick, they take a lot of echinacea to help build up the immune system. Golden seal, you may heard of that, or garlic can prevent and treat infections. In small doses, they're believed to boost resistance to infection. And in large doses, they might fight pathogens. So you also have, if you haven't heard of Siberian ginseng, it can protect the body from hazardous effects of stress and boost resistance to infection. So patients should be advised to consult with their healthcare providers before using an alternative therapy. but I did want you to know all the different alternative therapies that are out there. Is the following statement true or false? True. Look at the rationale to see why this question is true. As we come to an end, look at the discharge planning for older adults. Early and competent discharge planning is essential. Okay, remember, our goal is to prevent complications, reduce risk for hospitalization, and minimize stress. Look at the factors influencing post-discharge outcomes. Different things might have a effect on the discharge outcome. Look at your interdisciplinary geriatric team function, and discharge plans must address family and caregiver needs. Thank you for returning to listen to the last part of Module 6, Chapter 33, the ending part of the emergency section. Thank you so much. I will post, Chapter 34, long term, or I may do the lecture in class, depending on time availability. Thank you so much, and thank you for listening. Bye.